I think for many years in global health, we have brought solutions into countries without developing a framework in which they could flourish. When we were looking at countries where we could make a first start, Ghana came to mind for a number of reasons. There was a good environment and a willingness, a political will to make a difference.
Working with the Sickle Cell Foundation of Ghana, in collaboration with the Ministry of Health, Novartis put together a public-private partnership to address sickle cell disease holistically.
The ambition was the government of Ghana would come to the realization of the burden of sickle cell disease in the country, be able to prioritize that, and be able to ensure at the end of the project's life that the hydroxyurea would be taken on as a reimbursable drug.
We were also working with, for instance, local universities to develop treatment guidelines. We were putting in place a monitoring and evaluation framework.
Which kind of personnel do you have to have? Which kind of laboratory resources should you have? Which kind of clinical intervention should you be able to deliver? It is all part of the whole health system strengthening strategy.
When we signed the Memorandum of Understanding, our hope was to see improvement in the quality of lives of sicklers, improvement in capacity building.
The ambition of our program is to provide access to comprehensive management of sickle cell disease for patients who need it, where the burden of disease is.
In order to bring other stakeholders along, we made some catalytic investments, but we also actively lobbied, for instance, other private sector players to join the program on the diagnostic front, on the data management front, in order to make a bigger impact.
In sub-Saharan Africa, PerkinElmer's aim is to support and increase capacity for sickle cell newborn screening. I think what has brought us together is that we share the same common goal, and we can improve the advocacy effort in sub-Saharan Africa.
We realized that Novartis was operating in several of the countries where Konza is operating, and so that offered a very natural opportunity for collaboration to reach all these people who sometimes live remotely from major urban centers. It requires a lot of resources, and so Novartis has been helpful with accessing the required resources and also provide the materials that are required to educate the healthcare providers.
When my kid got sickle cell anemia and was diagnosed of it, it left me curious, wondering what's this disease, how does it present, what is it that we did wrong? So as I walked into Children's Sickle Cell Foundation, that was the beginning of learning of everything about sickle cell and where the gaps are. One of the things I couldn't believe was meeting other people living with sickle cell. Through that, I got interest in learning more about sickle cell disease, and over time, I then ended up becoming a sickle cell advocate.